just like to welcome everyone again to our Network Commons today. I think the success of multi-sector work really relies heavily on communication and centering community and trust. So it's a pleasure to create space today as we invite in a communicator who creates art through words. And we're joined by a spoken word artist, Hannah Hassan, who will share her work. So Hannah, thank you for joining us today, and I'm going to hand the mic over to you.
Thank you so much, Ruth. Good afternoon. Well, I'm on the East Coast in the South, but good morning to you all who are not, and thank you for having me. I'm going to go straight into a poem, a piece that I wrote specifically for today, and invite you all to just sit back and think about the people that we all get the opportunity to share community with and serve. When searching for the answers, the solutions, the wisdom, for how we heal what ails us, for how we make well where we are ill, for how we find the cure to what has harmed us, for how we find the medicine that will make us feel better, make us see each other, make us care for our neighbors, make us alter the systems and behaviors that have left some behind, that have left many without, that have found those living in pockets of poverty, within rural landscapes, remote cities and boroughs, and small mountain towns, on the edge of opportunity, seeking hope and help for the future of their home, for the well-being of their community. When we are seeking the ideas and sparks of ingenuity, the answer will definitely come back to what it has always been and what it will always be. The power is with the people. The everyday boots on the ground neighbors and workers who exist, live off of, feed off of the land and the environment around them, and the people who surround them, who stand up and stand in for them day to day. The next door neighbors, plant and factory laborers, that one doctor in town, the community organizers, the small town mayors, the grocery store workers, teachers and bus drivers, the waitress working the double shift, the up before the sun 9-to-5ers, living in the community, working, doing the best that they can to build their home. These are the people with the remedy who hold on to the answers and the cures. These are the folks that our systems and solutions should depend on for inspiration, for education, for planning and understanding exactly what the people need, exactly how to design for a sustainable and equitable future. The people who live in these spaces are at the center of the playbook. For the people closest to the problems are the people who hold on to the solutions. That is what local control really means. It's when all forces align and prioritize community engagement. It's when resources are shared. It is found within meaningful collaboration. It's working side by side. It is when the organizations and the people are at the table. That is where we find sustainable and equitable solutions like humane housing, lifelong learning, and reliable transportation. And all of the things that we need to ensure that we are well, that our families and neighbors are taken care of. Local control is fostering an environment where the people are empowered to craft their spaces with love, to decide what the future of their home looks and feels like. Local control is structuring and restructuring from the inside. It is building by the people. It is healing from within. It is at the center of how we have always cared for each other. It is where the process should begin and end, in centering the people's voice, That is how we foster healthy communities. That is how we remind our neighbors that they have a choice of what happens in their home, of which programs and processes should be in place, of which places and spaces belong. This is where we find the future of how we heal together. This is how we continue to build healthy places and communities of care with creative collaboration, inspired and inclusive activation, and the people who occupy these spaces, the people who have always been there. Thank you.
Thank you so much. Amazing. Thank you so much, Hannah. That's just wonderful. The people at the center. Well, what a great start to our Network Commons today. Welcome to those of you who have just joined us. My name is Ruth Thomas-Squance, and I'm the Senior Director of Field Building at Build Healthy Places Network. I'm speaking to you from San Francisco, the traditional land of the Ohlone people, and we're excited to welcome you back to our Network Commons. And if you've been here before or to first timers, welcome to this space where we explore topics relevant to multi-sector approaches to improve health equity through facilitated conversations from experts, practitioners, and advocates from across the country. So I'm delighted that we are joined today by someone who has a long history in working to advance rural health through policy. Tom Morris is the Associate Administrator for Rural Health Policy in the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The office has an annual budget of $317 million and administers a range of research and capacity building grant programs that serve rural communities. He has past work experience in the US Senate, as well as various policy and program positions, I think, at Human Resources and Service Administration and the Health and Human Services. And we at BHPN are really grateful for Tom's support as a member of our National Advisory Council. So Tom, I'd like to invite you to share some of your remarks to set the context of our conversation today.
Well, Ruth, thank you so much. And Hannah, that was just beautiful. What a great way to start this meeting, and also a very tough act to follow, but I'll do my best. And anyway, thank you for the opportunity to join you all today. I really appreciate BHPN's development of the Rural Playbook, but their work more broadly. And my hat is off to Doug and Ruth and the whole BHPN team for their work on this. It's one of the best resources that I've seen in recent years, because it really does a great job, I think, of tying together the concepts of improving health, economic development, and community vitality in rural communities. I include it in just about every presentation I make. And in fact, back in June, we had a meeting of about 100 or so folks interested in rural philanthropy, and Doug Jute spoke at it. And he was the last session, which is usually the toughest session, but he talked about the playbook. It had just been released that week, I think, and he had the highest rating session. So it's really resonating with people, and I think it's a great resource. I think it also comes at a very opportune time. I'm probably preaching to the choir here in the sense that, the challenges of rural health are well documented. They run the gamut, from access to care to not having enough clinicians. We've got long-standing sort of health disparities that link to higher mortality and lower life expectancy in rural communities. We've seen 139 rural hospitals close since 2010, and many more of those hospitals are in financial trouble. And that's important because they're often the linchpin for healthcare in a small rural community. And I think things can get even a little bit more challenging when you drill down into specific issues, whether it's maternal mortality or the gaps we see in behavioral health care services, especially as we see new crises emerging from the opioids epidemic and now switching over to fentanyl, and just what's this doing to rural communities. And then, I think it's also worth noting that if you just stop at the rural metrics, you really miss a very important issue around health equity and inequity in rural communities, as we look at even more significant disparities as we drill down into racial and ethnic populations within rural communities. We've got these aging hospitals and clinics. They're heavily dependent on Medicare and Medicaid. And you often see this phenomenon, unfortunately, where people with good private insurance drive past the local hospital or clinic, going to the next bigger town under the perception that bigger is better. And this almost creates a self-fulfilling prophecy in terms of putting places at risk. And these issues, as all of us know, are very interconnected. They don't operate in isolation. And they're also connected to larger structural and challenges that rural communities face writ large. Small populations, geographic isolation, higher poverty rates, lower educational attainment, limited tax bases. I think about some of the communities out west that are surrounded by forest land or or national parks. And so you don't have the tax base to sort of raise the money to provide a lot of the services that are needed. And then so often in rural communities, the burden of leadership is shared among a very small number of people, and that leads to high burnout. And so all of those issues are incredibly daunting. The work is not easy, but I think the thing that is important that always bends me back towards hope is what I see happening at the community level. And one of the things I like about my job, that I feel very honored to be able to do, is that we are hyper focused on rural community health. We fund about $80 million a year in rural community health projects. And one of the great parts of that is each year when we finish the fiscal year, the staff will take a day and just run through every new grant we funded, what community it's in, what they're trying to do. And you see such creativity and innovation that's going on that it gives me hope that even though all those things I just mentioned, that can be pretty depressing, it gives me hope that at a community level, town by town, place by place, that we can make a difference in this and we can begin turning some of those things around. We're lucky in the funding that we have in that it's very flexible. It's not a word you hear often with the federal government, but I'm here to tell you that our funding is. The people who created it were very smart. They said, we want you to basically improve access to and coordination of local services. And then they did something that I think is really embedded well into the playbook as well, which is we don't want you to fund a single entity. We want you to fund a group of entities at the community level, realizing that in rural communities particularly, we have limited economies of scale. And so if you can fund a network, a collaboration, a group of entities, you have a better chance of vesting it in that community and keeping it going beyond the funding. And I think that's part and parcel of what the playbook is all about. And so, as we begin the new fiscal year, I'll get another chance to see all the new communities we're funding. And, I think it will embody a lot of the things that we see in the playbook that's been created. And you're going to hear two great examples of that today with Rebecca and Beth. I also want to note that it's very significant that the BHPN folks did a rural specific playbook. So much of our clinical evidence base is urban focused. We develop programs in urban communities, we do research in urban communities, and then we leave it to rural communities to sort of pick up those pieces and figure out if it works or not. And you just can't downsize a project and make it work in a rural area just because it worked in an urban area. And so I think the playbook does a good job of sort of striking that balance. The reality is that there's a lot of well-intentioned people who are trying things in urban areas and want to share them with rural. And there are some commonalities in there. This whole notion of collaboration and partnership is as true in the biggest city as it is in the smallest town. But I think there are also places where you have to take into account the unique geography, the limited infrastructure, and the geographic isolation that rural communities face. And so that's what's great about the playbook in the sense that it really, very intentionally did that. And I also think it does a very nice job of framing health in a way that any sector can relate to. Healthcare can get pretty wonky. And I think we lose a lot of folks when we dive into those things. But the notion of health, of doing whatever we can to build a healthy community, anybody can relate to that. And I think we're also all becoming very aware of the interconnected reality of all these healthcare issues, but also how they're connected to larger community issues in rural areas. And so one of the issues that I think we all struggle with is access to capital to fund the resources and programs that we need. We're funding a new effort by the State Offices of Rural Health to really look at how we can better link to the sources of capital in this country and then make sure that those investments that are their fair share is happening in rural communities. And so they're spending 2 years really building those relationships and learning more about that world so they can then bring those resources to bear in rural communities. So again, we're looking forward to the partnerships that that's going to create. And so there you have that word again, partnership. It's the foundation of everything, as Hannah noted. The reality is in rural communities, there's no other way to do it. If we act individually, we're never going to be able to address these things. But if we can act collectively, I think we have a chance. And so I think you'll see with our speakers and the dialogue that I hope we'll have at the end, we're going to do a deep dive today on this and really learn about the difference people can make when they work collectively together. So thank you for the opportunity to join you.
Thank you so much, Tom, for that wonderful introduction. I'm very grateful for your support of our work and excited to dive in. So by way of introduction to those of you new to our Network Commons series, Build Healthy Places Network is a nonprofit organization and program of the Public Health Institute in Auckland. We work as a national centre looking to transform the way community development, public health and healthcare organisations to work together more effectively to reduce poverty, advance racial equity and improve health in communities across the country. So heavily focused on that partnership angle that Tom mentioned. So our commitments in this work are to advance health equity through inclusive strategies that address the root causes of health inequities through community investment. We also advocate for more effective and sustainable impact through centering rural communities in the process, in particular groups whose voice and power are commonly excluded. So part of our field building work is to support practitioners looking to participate in cross-sector health partnerships by providing tools and resources, making connections, and just generally momentum building. So we realized that, as Tom mentioned, that much of the work and resources featured by the network had an urban bias. And we set out to learn from rural practitioners across the country what was different and what was the same when you're embarking on multi-sector health partnerships in rural areas. So we dived into a learning from those working in the rural space, and the outcome is the Playbook for new rural healthcare partnership models of investment that we released a few months ago. The Playbook has developed as an action-oriented guide and practical tool for healthcare organizations, but also others wanting to pursue partnerships across sectors to create community conditions and infrastructure to support healthy communities. As we conducted interviews, researched, and held group discussions in the development of the Playbook, our broad strategies, 4 broad strategies emerged as being useful frames for this work. And I wanted to emphasize, I wanted to emphasize that many projects in practice will not discretely sit in one strategy bucket or the other, as you might expect, but they'll present as multi-strategy approaches. And in fact, you'll see that in the projects that we are discussing today, some of those will come up in multiple sort of strategy formats. But these categories can be helpful, I think, in conceptualizing the work and the possibilities when you're considering embarking on similar partnerships. So I'll introduce the 4 strategies now on the slide. Strengthening economic opportunity and workforce. We'll see economic stability and common health are 2 interdependent factors. And with economic stability being such a major factor in poor health outcomes, there's an interplay between the fate and stability of rural healthcare institutions, both as service providers and really as employers and economic drivers in communities. So we see strategies that embrace this role, driving workforce development, strengthening career pathways, or indirectly through creation of workforce housing and childcare, both pretty important factors for rural healthcare competing in terms of recruitment and retention of staff. The next strategy is supporting local control. Some rural healthcare institutions are supporting community ownership models that help close the racial wealth gap to reduce health disparities. And these collective ownership strategies can work through vehicles such as land trusts, which we're going to hear about a little more about today, or things such as promoting food sovereignty, and finally, policy changes that can advance community investment or need land use changes. The third strategy is strengthening infrastructure to support healthcare access. These strategies build and strengthen community infrastructure that is necessary for effective healthcare delivery. For example, we often hear about the physical challenges in connecting rural healthcare to dispersed communities that need their services. So examples of this can be collaborations with partners for co-location of services to improve access, expansion of broadband is another, or improving transportation, which is one that we're going to hear about later today. And finally, increasing resources. So in several cases, we came across a strategy where healthcare investment in rural development served to increase access to resources by diversifying a project's funding base, or through donation of land to support community-based projects. And we're going to hear about that in our discussion today too. So with those strategies in mind, Let's hear more from our panelists about some of the case studies that illustrate and really bring this to life. So first, I'd like to welcome Beth Daniels, CEO of Southwestern Community Services, a community action agency working to combat poverty in New Hampshire. So this was incorporated in 1965, and SCS is one of 5 community action agencies created in New Hampshire that were all founded by the 1964 Economic Opportunity Act. So SCS's partnership with Dartmouth Hitchcock Medical Center supported the development of transportation infrastructure, and it's featured in our playbook under the section Strengthening Infrastructure to Support Healthcare Access. As I mentioned earlier, several case studies bridge across more than one strategy, and this one is no exception. So it also includes some features from increasing resources, which we're going to go into in our discussion. So Beth brings vast experience with over 2 decades of work at the agency under her belt, and we're very excited to have her on our panel today. So welcome, Beth. Next, I'd like to welcome Rebecca Lemons. And Rebecca serves as the Regional Director of Community Health and Wellbeing for St. Alphonsus Health System, which has hospitals across Idaho and Oregon, and is a member of the Trinity Health System. So the project Rebecca worked on addresses a different social determinant of health, that of housing. So St. Alphonsus Health System partnered with Leap Charities, a local nonprofit and an affordable housing developer in Deedwell, to create some high quality, energy and environmentally rated affordable homes to address skyrocketing house costs. So St. Alphonsus became the first investor in the Leap Housing Trust, a land trust using community benefit dollars, hospital foundation funding and grant funding intended to address social determinants of health. So this case study of this work is featured in the playbook under supporting local control, but also features some elements of the increasing resources, as I mentioned. So this community land trust model is a very effective way of maintaining lasting affordability of housing and asset building through shared equity home ownership. And Rebecca's worked there for more than 10 years for the state of Idaho in both the Idaho Department of Health and Welfare Division of Public Health and the Central District Health Department's Division of Community and Environmental Health as a policy analyst. So we look forward to hearing more from you about your work, and I just offer a welcome, Rebecca. So finally, I'd like to introduce my colleague, Ashley Hernandez. Ashley is BHPN's Resource and Content Manager, and she's going to be our moderator for the discussion today, along with these great panelists. So I think with that, I'll hand it over to you, Ashley, and look forward to hearing more.
Yeah, thank you so much, Ruth. And before I begin the conversation, a quick note about technology. So Zoom webinar has 2 features available, and I think lots of folks have already figured this out, but we have a chat function and a Q&A function. So if you have any technology issues, please use the chat box feature and we can troubleshoot with you. If you have any questions, please use the Q&A feature and we will get to some of those questions after we talk with the panelists. And so one last thing to mention, if you are a Twitter user, please make sure to go ahead and tweet about the Network Commons. We actually have a hashtag Network Commons. It's all in one word. In addition, we will be adding to the chat box now BHPN's Twitter handle, as well as some of our speakers and their organization's Twitter handle. And with that, I'll go ahead and get started. So this first question is both for Rebecca and Beth. So based on your partnerships outlined in the playbook, what would you say are the major roles and strengths the other sectors brought? And what is your sector's contribution to these partnerships in rural communities? And Rebecca, I'm going to go ahead and get started with you and drill down to the specifics. So can you tell us about your partnership with Leap Housing, an affordable housing developer, and how it helped your hospital tackle the affordable housing crisis in your state? What can healthcare bring to these partnerships in rural communities?
Thanks, Ashley. So we were really pleased to learn about Leap Housing early in our journey to start to figure out how to address housing as healthcare. And part of the reason why we chose that was because our community health needs assessments, as well as our social care screenings that we do with our patients, we're clearly identifying housing as the top need or social determinant in our area. Boise region has been one of the fastest growing housing markets, and that's only become more acute since the COVID crisis started in 2020. When we originally met with LEAP, we met with them because, one, they were a mission match for us. They were an organization who was really focused on providing affordable housing, doing a variety of first-time homebuyer education. Boise is a refugee resettlement community, and they also had some amazing programs for bringing new Americans into our community, which was very important to us and our mission. So we started having some very organic conversations with them, and they really became a teacher and a mentor for us. As an affordable housing developer, I'm a public health practitioner working in a hospital setting. I didn't know much about housing 4 years ago, and they really helped sit down and educate us into different types of housing, different strategies for bringing different mechanisms into our community, and then also a little bit about funding. I do not do affordable housing funding by trade, and so they really helped explain a lot of the ins and outs to us. So they were an incredible mentor and teacher to us. And then we started having organic conversations, and I think anybody who works in a rural community where you feel like the same 10 people are at all of the tables, you can understand that starting to have these conversations about, we think we want to do something in housing, but we really don't know what to do. It feels like trying to eat an elephant all at once. How can we be a meaningful partner? And they guided us in that. And actually, it was through those conversations that we started talking about specific projects. And that's when the land trust came up. And so I think that they're helping us understand what is housing, what are different ways of doing it, how can we funding, what kind of funding, and then how can we be a meaningful partner was tremendously helpful. In terms of our role as a health system, we've matured and become wiser about this through these kinds of organic conversations with LEAP and other mission match affordable housing developers in our area. And we've learned a couple things. In this case, we were a funder. We helped bring money to the table, which was great for us because we were able to leverage our dollars, right, to take them even further in the community. So we were able to do that. Sometimes we are a convener. Oftentimes we bring people to the table, especially in rural communities where there can be some concern, and I'll talk a bit more about that later, about affordable housing or some of the other issues around how are we going to do this safely in our community. So we can bring partners to the table to discuss the issue at hand and to talk through how we might strategize together. We're a data provider, so we do community health needs assessments every 3 years, and ours is deeply focused on gathering community voice. So we don't just do all the numerical data, but we really do a deep dive with community members who are experiencing challenges to understand what their needs are and what their desires are. So we can bring that data to the table. We also do social needs screenings with our patients at St. Alphonsus. And so we were able to clearly say, look, between 2020 and 2021, we've had 677 requests for assistance with housing. That's a big deal for us as a hospital. So we could bring that data to the table. And then finally, I would say we are an advocate. So a lot of times when we want to start a new project, it's great to have our little coalition of folks that want to do things, but we may have to go talk to the municipality. We may need to get involved with planning and zoning to change very agricultural land into housing, or land that's set aside for something else into housing, and make that case for why that is going to be. We also have to explain how we are going to wrap around the residents. We're not just building housing and leaving people there, but we're looking at the other social influencers or determinants of health and asking what else would we add on and what services can we provide around this housing service. So those are just a couple of ways that a healthcare provider can lean in to be a meaningful partner in this affordable housing space.
Yeah, thank you, Rebecca. And likewise, Beth, can you talk about healthcare's role in supporting Southwestern Community Services' ability to take on transportation as a critical infrastructure need in your community? Likewise, what can community-based organizations like your own contribute to these partnerships in rural communities?
Thank you so much. Here in New Hampshire, I'm sure everyone can understand that most of our transit provider networks and systems are pretty rural to begin with, which means they're also very isolated. So we have great little transit provider systems, but each one is very much one unto itself and very spread out throughout the state. With that, here at Southwestern Community Services, we had started running the regular, the ones that were already in place, bus routes, which we took over operations for in 2016. And with that, there were 3 of our primary towns in that county in New Hampshire, where we were operating bus routes. And what we realized is we were missing a large segment of the population with their transportation needs, which were primarily to get to the next county, to access really the doorway to the largest medical provider in the state of New Hampshire, which would be Dartmouth-Hitchcock. And with that, we were missing also the opportunity for some of our workforce development programs to access Dartmouth-Hitchcock for internship and medical training opportunities for some of the students. So there were some healthcare pieces being missed. There were some workforce development pieces being missed. So one of the things that I think we brought to the initial conversation was the fact that we had some infrastructure, limited, but we had some infrastructure in place. So when the healthcare provider was able to come to the table and say, you know, we have an awful lot of patients who are missing appointments, and we're finding that one of the biggest reasons is due to transportation issues. So that affects us on a variety of levels. The first one obviously being the patient getting what it is that they need. So let's talk about this. And when we really broke down the way that transportation funding works, we really tried to explain there's a whole host of things that need to happen to open and maintain a bus route. It's really a long-term investment, a large undertaking, and it really is something you design if you start the way you plan to proceed. If you're going to open a bus route, it's a public bus route now, and it better be there and it better be available. And so we explained that with the way the backbone funding comes from the New Hampshire Department of Transportation, there's a pretty significant match that needs to be secured in order to access that larger pot of funding through the Department of Transportation. And that local non-federal match funding is a challenge. It's a challenge to come up with. And Dartmouth-Hitchcock, they were a major partner at the table, but they were also one of the first partners at the table. So they provided, their sector really provided the financial assistance. They provided some data to really kind of bring some credibility to the project, and just their investment alone brought weight to the project that the largest healthcare provider in the state wanted to see this new bus route open, and they were prepared to be kind of in lockstep with us from the beginning of the project to the end of the project to make sure that it was possible, that it was implemented, and also longer term that it could be sustained.
Great, thank you, Beth. So what I find really interesting is there's a common thread between both of these case studies, where both Southwestern Community Services and St. Alphonsus Health System both relied on building trust and social capital, which is one of the cross-cutting themes in our Rural Playbook. So what specific value did this bring to your partnership and the overall project? And this time around, I'm going to go ahead and start with you, Beth.
When I think about some of the partnerships that we've created over time here, and I think back to how some of those really started, they were in some of our regional meetings that took place. I think Rebecca mentioned sometimes in rural areas, it feels like it's the same folks at the table quite often. But we have some partner meetings that take place on an ongoing basis, as well as the Public Health Network meetings, which are the Public Health Advisory Council meetings. And the linkages, the connections, the easy wins there, where you can see where if someone were to do X, Y, and Z, and this other individual was to bring something to the table, you would be able to check not just one, but sometimes 3 or 4 different goals off the list by just having individuals at the table who cross over different fields. And the Public Health Advisory Council, the Public Health Network meetings, is where a lot of that seemed to take place. And it started with the communication, with the trust, with the information sharing, with recognizing that I can only go so far, and having someone who will either pick up the baton and take it from there, or who will provide me with additional support and strength to kind of move things forward. It's really the way to do it. On that note, the Public Health Network part of that conversation and communication and trust building was around their commitment to make both housing and transportation community health improvement plan priority areas. So they did build it into the actual regional plan that some of the things that might 10 or 15, 20 years ago be considered more in my wheelhouse, transportation and housing, they were saying, oh, no, we recognize these not only as social determinants of health, but as key priority areas as we move forward as a health network. And we want you to assist with that, and we want to assist you with your efforts. So solidifying that, it all really started with the communication and being willing to come to the table and making those meetings a priority, and hearing folks that when they say that the patients have needs that are not being met, that it's not a shortcoming of folks who are trying to provide the service. They're doing us a service by giving us that information. So the communication's key, the trust building is key, and just kind of showing up with a solution focused perspective is pretty key.
Yeah, thank you, Beth. And Rebecca, can you tell us a little bit about how that trust was really instrumental when translating the land trust model from an urban community to a rural community?
Absolutely. I think a large part of our participation in affordable housing projects, both this land trust as well as other projects that we've invested in frontier communities even, has been our unique voice. And so it really started a couple years ago when we really started getting out and talking more and more and sharing our data. And then not just sharing the data, but sharing the stories behind the patients, the colleagues, and the community members that were experiencing various issues because of housing. It brought a level of credibility, and it perked the ears of folks who hadn't really been attuned. They heard housing. Yeah, housing's an issue. It's unaffordable. It's a big deal. We don't know how to deal with it. Oh, the hospital's getting involved. Wait a minute, the hospital's getting involved. It was really interesting to go not only to use our voice to bring partners to the table, to bring other sectors into the housing discussion, to help them understand their role and their place that they could have just like us. How do you fit in? Where can you contribute? How can you participate in this alongside us? But it also started to get the ear of policymakers, and that was a big deal because we can do all the small efforts we want all day long to get initial developments, but we really need the support of our folks at the municipal as well as the state and federal levels to continue to support these types of projects. And so we were able to use that unique voice and our trusted name and social capital as a health system and the partners we brought alongside of us who are not traditionally housing specific folks to talk about this issue with our policymakers. That was really critical and important. And like I said, that's really when you get into the details of we need some help with zoning. We need some help with getting approval for these projects. In rural communities, there's a very big concern for infrastructure. And what we're finding is more and more right now, it's difficult to get affordable housing developments or any kind of housing approved in our very rural communities, because that means we need more schools. We need more planning around our transportation networks and the services we're going to provide. And there can be some hesitancy there. Our voices and our partnerships also lended to some credibility. There are concerns around affordable housing. There's a lot of myths. You guys probably have heard of NIMBYism, or not in my backyardism, which is a term that many folks use in communities when there's fear among residents about what is affordable housing going to do? Is it going to lower our property values? Will there be increased crime? Will there be blight in the community? And we know that, and we can tell the stories that is not true. There are many research studies out there that that's not the case. And so our voice helps lend to that credibility to say, no, we're here to come alongside these developments. They are going to be reverent and beautiful and diplomatic. This case that we did, Caritas Commons, with our land trust, they're beautiful homes. And the community is thrilled to see them and have them. They're very dignified. And so we're able to bring a lot of that there. Additionally, we are able to bring a diversity of partners to the table because we were the first to bring our investment, and we got scrappy because in rural systems, you have to do that, right? We contributed $240,000 to the initial investment into this land trust. That is a big amount of money for a hospital. It doesn't sound like it, but it is. And we used multiple sources. But what we were then able to do is go and talk to other people about why What's our why behind investing in housing? What's our why behind this project, which is unique in the way that it's set up, to get other funders, other investors into the project. What I'm excited to share with y'all today is a little update. So Caritas Commons, which was, we helped contribute to 6 of the first 11 single family homes, shipping container style homes being developed on this land. They've been fully sold, families have moved in. Not only have we initially invested in those 11 homes, or 14, excuse me, homes that were going to be built there, there have been 3 additional developments that have contributed to that initial land trust across Boise and now into Mountain Home, Idaho. Now, Leap Charities just launched their strategic plan and their vision for the next few years last week. And they're actually going to take this land trust model statewide and be attracting regional investors and developers all over our state, which is predominantly rural and frontier, to be able to use this land trust model to bring about innovative housing strategies to multiple communities. So we're really excited to be able to be a part of that and to see this concept grow and be able to be adaptable into the different types of unique housing needs that other rural communities in our state are going to be experiencing.
Thank you, Rebecca, and congratulations on that update. That's really exciting news. I'm going to go ahead and lead us into our last question. So again, this question is for both you, Rebecca, as well as you, Beth. What are some of the greatest challenges in forming partnerships with other sectors, especially in rural communities? And we don't want to just focus on challenges. We also want to think about solutions. So what were some of the workarounds that you used to address those challenges? And I will go ahead and start with you, Rebecca.
Thanks. I think some of the things that we've needed to do was, again, some education with our partners in terms of what exactly is this housing crisis? What is needed here? And what are some different ways to do that? And how can we be involved? What was cool about the land trust is, while we certainly have invested in multifamily, multiple unit, traditional, affordable developments, one of the things that we were hearing and thinking about is this need for a diversity of opportunities. In the Boise proper area where we were doing this particular land trust, the housing market at the time had skyrocketed, and the average purchase price of a home was $550,000. That makes it darn near impossible for folks to be first-time home buyers and to be able to afford a home. And we heard story after story of folks who are stuck in this mobility issue of, I'm renting, but I'm not able to make any headway. And so we were able to work together to educate our partners about, we can continue to do these multifamily homes developments that are rentals that are very much needed. But in order to really think clearly about how we can create some mobility for people, this land trust offered the ability for us to help purchase the land underneath the homes, to keep it affordable in perpetuity, which was a huge draw for our leadership at the hospital, as well as a number of other organizations, to say this is going to stay affordable in perpetuity, but allowed us to create single family homes that were priced in the $270,000 range. Again, remembering that $550,000 was the average for a home purchase price at the time. So $275,000 for families meeting certain income restrictions to be able to get into a home. And then with a land trust model, they're able to take the equity, they are able to get equity in that home to move on and then move up into other housing types for themselves. And so it was a really unique opportunity to address a different part of the housing market and a different type of housing product that is deeply needed, in addition to the multifamily homes. And so this was really great because we were able to offer partners who are skeptical or nervous or not really ready to invest in the multifamily home concept to participate in something that was really appealing, which is helping first-time home buyers and folks who are looking for a single family home to be able to afford to do that, and then to see your investment continue to create affordable housing in an ongoing way. So it was just getting people to the table, educating them about the needs, the different housing types, and then bringing them around to this particular opportunity as one of those options for them to lean in, invest, and participate in that housing development.
Thank you, Rebecca. And Beth, can you tell us a little bit about some of the challenges and your organization's workarounds?
So as a community action agency, we actually operate and implement a lot of different programs and services at once, everything from Head Start to WIC to affordable housing to homeless shelters, just the list kind of goes on and on. with all of that, there's a lot of toggling between different funding sources and compliance and just kind of making sure that you've always got your ducks in a row. So when you're bringing in an outside partner who is enthusiastic and ready to invest and commit to seeing a project through to fruition, it can be troubling and a little challenging sometimes when you've got to try to break down for someone how things work, where the funding comes from, what the requirements are for that, what the timeline is for that, and all of those pieces and parts. When it came to developing this bus route, we actually had to do a feasibility study. There were a lot of different moving parts over time to develop it. And what we found was that the best way to move forward when you've got multiple partners, some who want to see something happen right away, others who want to see all kinds of things done ahead of time before actually implementing a project, is to communicate, not more so than just we're working on it, we'll let you know, but really breaking it down and just being fully transparent to say, these are the requirements of the Department of Transportation. This is where we're at in the process. Here's a copy of what we just submitted. This is just to keep everyone not only invested, but present with the project, because some things you can really get off the ground very quickly, and others, the more partners, yes, the further you can go, but also the more complicated it can become. So one of the workarounds for us was just regular project check-in meetings, where we really just provided any and all information people wanted, so that they were not just being told that there was progress being made. They could see it, they could feel it, they could read it, and they had all of the information at their fingertips. And that really helped with the entire process.
Yeah. So thank you so much to both of you for sharing such rich and interesting information on what it actually means to be involved in a successful cross-sector rural partnership impacting health. So I'm going to go ahead and kick off the Q&A session. So thank you again for those of you who have submitted questions during this discussion. Please continue to submit questions using the Q&A tool. And we have received quite a few throughout the session. So thankfully, the BHPN team has reviewed them and found a number of common themes. And so our first question, I'm going to go ahead and direct this to you, Rebecca. Some folks are really interested in learning more about the Boise Land Trust model. So do you have any information about the Land Trust model, and in particular, how it might be applied to other states? So for example, this audience member is curious about how it could be applicable to Tennessee.
Sure. The beauty of a land trust is you can do it anywhere and you can make it as large or as small as you want. Like I said, our land trust originally started as 14 homes in a single development, just one plot of 14 homes. And now it spread to 3 other developments across multiple communities where we had specific plots of land and different numbers of units on each plot of land. And then now LEAP is taking it statewide, which is going to be incredible. So you'll still have different sites, but the trust is a single point of funding that investors can put their money into to leverage their dollars together to be able to buy the land that is held in a trust that then keeps that land affordable. And you can set the terms for what that looks like specific to your community and what the housing rate or market would be. You can also identify the terms of the income eligibility for the folks that might be living on that. And you could also do this for multifamily. It doesn't have to be single family homes. That was just a unique opportunity for us in a market where we didn't have a lot of that being built at the time, and there was a deep need for that. There's a lot of interest in information on different studies around land trusts that you can engage in. I know LEAP, if you go to LEAP Housing and their website, you can find some information about that and their new strategic plan and how they're expanding that particular model. And then again, our case study here in this rural playbook kind of talks a little bit about how we do that. But also I welcome folks to email me if there is interest in learning about the shared equity and exactly how that works, things like that, some of the details of how to do a land trust. But they're gaining popularity. I'm excited to share that this was the first in Idaho, but now we're seeing them crop up all over. The city is leading several in our area, and other folks are picking up on this land trust model as a great way to leverage folks together, especially around housing, which can be really expensive, and no one entity can usually do that alone.
Yeah, and Rebecca, we do have a few follow-up questions around the land trust model. So for example, how does the initial home buyer take the equity with them going forward? And for the investors in the Idaho Land Trust, what is their projected return on investment and how long will they have ownership in the land trust?
So the way the land trust works is you put the money in and it stays there. So in our case, Leap Charities as a nonprofit holds the fund for the land trust. So we give the contribution and then we're pretty much out of it and it stays there. That land stays there. It's technically owned by Leap as the nonprofit, but it's written into the covenants with the folks who are buying the houses on top of the land, that while they can sell their homes, it still has to stay in a certain affordability range so that they can take that equity with them when they go. And so what it is they own the home and that component of it. What they don't own is the land underneath it. That is held by the land trust, which is in our case held by the nonprofit at Leap, with that intention of that being perpetually there. So there's a lot of details in the way that these things are written. And again, they can be crafted in a unique way for each community. But that way the people are able to take the sale price of the home while the land stays affordable. And then when they go to resell the home, it still has to stay within a certain level of affordability specific to that community. So the affordability levels are specific to what the Boise market is doing at that time, if that helps it make some sense.
Yeah, great. And I think we just have time for one more question. And I think I'm going to direct actually this question to both of you. So if you are a community-based organization that's trying to broker a relationship with a hospital system that has not yet bought into this idea of investing into social determinants of health, what advice do you have in terms of making the case that hospitals should invest in community health? And the reason why I want to pass it to both of you is that, you know, you have the outside perspective and Rebecca, you're the insider. So any pieces of advice?
I think the public health networks, anything related to the public health networks is a really great in because they tend to have a foot in both camps. They tend to be involved with a lot of community activities, while they also tend to be still very internal to the hospitals. So they have a sense of the challenges that the hospitals face while also having a sense of the needs of the community. So the public health networks, in my opinion, would be a really good way to kind of start some of that dialogue. But really, I think any of the examples that I'm sure any of us can give, 10, 15, 20 years ago, when someone would release someone from the emergency room and they'd have their insulin, if they were going to a tent in the woods, chances are you're going to be seeing that person again very soon. I think it just drives home for everyone that all of these things are connected, and being able to approach anybody, individual, community level, household level, recognizing that there are many different levels to health and there are many different moving parts to it. And some of those social determinants of health play as much a part in it as your background, your medical history, your family history, where you live, how you get where you need to go, whether or not you have access to counseling. All of those things play pretty heavily into your overall health. And my experience has been the public health networks tend to have a sensitivity to the challenges that both the medical healthcare field and the social services field, what they both experience, and they are a great conduit.
Great. And Rebecca, any thoughts?
Yeah, I would say, I know when we started early investing in housing, it was really in folks experiencing homelessness. And what we were looking at was our highest utilizers of our emergency services and emergency departments and folks that were coming more frequently, right? And so that kind of contributed to our initial investments in some different projects before we got into this affordable housing piece. And so I think from that initial standpoint, for maybe health system leaders who aren't as deeply attuned to the social determinants and how they are impacting patients, But beyond that, I think if you go to any health system's emergency department, their social workers, their community health workers, their discharge planners, and you talk to them, to Beth's point about what are your greatest challenges. I know for my team right now, our community health workers, we can't discharge people to cars and tents, and that's what's happening. And then we're feeling this impact with our own colleagues now. And that's another side of the story that you can bring to your leadership as the hospital to say, this doesn't just benefit the people of the community and our patients, this benefits our own colleagues right now, because we are struggling to keep and recruit our own colleagues because they can't find affordable housing, they cannot find affordable quality childcare, transportation is a challenge. We're having to address these issues. So if our own colleagues are facing it, imagine what that's doing for our patients, and how likely are patients going to be able to follow our medical or clinical advice if we're sending them and discharging them back into communities where they can't, they have food insecurity, they're living in untenable housing conditions. And frankly, they're not addressing their health needs because all of these other things financially are happening to them first. So I think telling those stories, showing that return on investment for the health system in terms of, people being able to actually do the things we want them to do from a clinical perspective, and reducing that frequent utilization rate of emergency services has really helped to kind of start to tell the story. But once we get into it, it's also a real mission match for a lot of these health systems to be able to participate in communities in these different ways.
Yeah, thank you so much to the two of you. I'm going to go ahead and pass it on to Ruth, who will close us out.
Yes, thank you, Ashley. And thank you to our amazing panelists. Thank you, Beth and Rebecca, for such a great conversation, really focusing on details. Thank you to Tom as well for those introductions, and really setting the context of our conversation, really focusing on partnerships. And of course, thank you to Hannah for such a beautiful start to our webinar today. It remains for me to ask you to please take a minute to fill in this survey that we share. We really try and make these resources as useful as possible. So your feedback helps guide that process and make sure that we keep things relevant. So the survey, it's just quick 2-minute, just a few questions, is being shared in the chat now. We also wanted to share some more, and we will follow up with more resources. But in the meantime, we can guide you to our rural resource page, which can direct you to several things like partner finders, finding other organizations across different sectors, and also the actual playbook. So if you follow the rural resource page, one of the things we also have on our website, which is bhpn.org, blog from the state offices, our partners from the state offices from Rural Health just wrote a really great blog for us about how state offices for rural health can be partners with community development. You can check that out. And there were a lot of questions about the land trusts. We actually have a crosswalk essay that's published on our website that discusses a little bit about healthcare investments in community land trusts. So you can get some more information from that there. And another organization that has a lot of information about community land trusts and how they work is the Grounded Solutions Network. So that's the Grounded Solutions Network. And so you can check that out now. That remains to just say thank you all for joining us today. I hope you found this conversation as fascinating as I did, to really get to how these partnerships work in rural areas and bring the resources together to support great health. Thank you very much, and have a great rest of your day.
Thank you, everyone. Bye-bye.